our status quo on health care is not acceptable, and that is why the Affordable Care Act is the right thing to do. And I think, again, our goal as an administration is not just to have every single thing exactly as we designed it the moment it passed. What we would like is to have a constructive conversation where people recognize that we have put into this virtually every good idea people have had for more coordinated care, for more efficient care, for aligning payment with the right incentives, not rewarding or letting hospitals get away with readmissions that are completely unnecessary. These are all the good policies. If we didn't get it exactly right, let's have a discussion about it, as opposed to deciding you're going to name something repeal the job-killing Health Care Act and make that simply a political soundbite, a political message, when we're supposed to be talking about this important issue. And if you think this is separate from Medicare, it is not. Let's be very clear about one thing. The main reason that Medicare's costs are going up in our country, spending, is that we have had the long-awaited aging of our population. In 2020, in 2000, when I left as NEC director under President Clinton, there were 45 million people on Medicare. Today, in 2020, there will be 70 million, 25 million more. That is going to increase costs. That's why we did all the fiscal discipline in the 90s, so that we were ready for that. The growth for each enrollee is about 2.92%. That is lower than the growth of healthcare in the private sector. So if you're not doing the type of things that is bringing down costs in the overall system, you are likely to be back to the game of shifting costs from one party to the other, instead of us as an economy trying to figure out how we can spend less overall.